Okay, are you guys able to see that? And remember, this is what we're picking to do for class, so you guys need to be logged in on here answering the questions, okay? Okay, there's a couple more we need. Julie's dog's gonna join us in the Kahoot. All right, is anyone else having a hard time getting in to the Kahoot?
I'm trying to.
Okay, we'll wait. Who's not in yet?
Well, me, but it's fine because my phone is not letting me do it, and my computer.
Can you join on your computer? Just go to the
I will
website.
have.
What? Should be able to
What
just
is
go to the
that?
kahoot.it and then type that in.
It's like putting me in there with another Kahoot
And you're doing the
that we already.
1516668 for your code.
It's not. It's not giving me an option to type it in. Like it's already in a Kahoot. I think it's the one we did last time.
Oh, is it going straight to it? Maybe if you go, can you back out and make sure it's just the kahoot.it?
Let me see. Kahoot.
Like type it all out.
Okay, yeah. What's the pin again? What's
It is 1516668. Okay. And now?
I'm in. Yep.
Okay, perfect. Alrighty. Tiffany, are you in on our Kahoot yet? Okay, there we go. Now we've got everyone. All right, we'll go ahead and start. Okay, so it's chapters 29 through 32 for this week, okay? Okay, multi-select. Nurses carrying a child with nephrotic syndrome is alert to which classic symptoms of this disorder: generalized edema, hyperalbuminemia, fatigue, or proteinuria.
Can you read that again? Because it's not showing on the actual Kahoot for me. I have to. Never mind.
Well, it's about nephrotic syndrome. So it said the nurse is caring for a child with nephrotic syndrome is alert to which classic symptoms of this disorder. And your options were generalized edema, hyperalbuminemia, fatigue, or proteinuria. And the correct answer is generalized edema, fatigue, and proteinuria. Because kids with nephrotic syndrome, they are holding on to that fluid, but spilling protein into their urine. So they're going to be edematous and they're going to be worn out because their kidneys are not working as they should. And then they're going to be spilling protein. Okay. They're not going to have high albumin in their blood.
And you said they're going to be holding on to the fluid.
Mm-hmm. Yep. That's why they're going to be edematous. Mm-hmm. Okay. Okay, another multi-select. GU surgery is especially stressful for preschool children. What factors lead to this stress? They fear death. They're sexually curious and developmentally fixated on their genitals. They have a fear of castration. They may perceive the treatment as punishment. And this was multi-select. Yep, good. They're sexually curious, developmentally fixated on their genitals. Remember what stage they're in for Freud, right? Anal stage, right? Because they're in that potty training stage and they're learning about their bodies and all of that. And then they have a irrealistic fear of castration, but it's something that they're scared of. And then they also have a fear that the treatment is a form of punishment. And they have that fear about a lot of things, not just, surgical intervention. Okay. What special considerations are related to long-term prednisone therapy in preschoolers? Increased risk for infection, alteration in nutrition, delayed immunization, or enlargement of sex organs. Good. So if kids are on long-term prednisone, their immune system is going to be less. Okay. So they're going to be more prone to getting infections. So you always get concerned about that with people who are on long-term steroid use or prednisone specifically. And then also because their immune system's being affected, they aren't able to get all of the immunizations that they should be getting. Okay. Specifically the live vaccines. So like measles, mumps, rubella. Okay. Any questions about that? Okay. Okay. To prevent a UTI, which is the best beverage for the nurse to recommend to keep urine acidic? Apple juice, orange juice, grape juice, or milk? So apple juice, actually. Okay. But what's another juice that you hear people talk about if you have UTIs?
Cranberry.
Cranberry.
Juice. Yep. Yep. So that would be another option too. Okay. Yep. Good. Okay. When weighing the diaper and subtracting the weight of the dry diaper, the nurse records 30 grams and documents blank mils. 30 mils, 10 mils, 60 mils, or 3 mils. 30. Yep, good. And how you weigh diapers, and you guys you read about this in your book and all of that and on the PowerPoints, but you put a dry diaper on the scale, zero the scale out, and then take that diaper off and then put the dirty diaper on top. Okay. Then that way it's already subtracting for the weight of the diaper, the dry diaper. And then whatever you see there in grams is what you're going to chart for your milliliters. Okay. For output. Okay. Good. Okay, another multi-select. Strategies to prevent a reoccurrence of UTI in a child. Wash and wipe the perineal area from front to back. Wear cotton underwear. Drink lots of fluids and void frequently, or take frequent bubble baths. Strategies to prevent the reoccurrence. Okay. Wash and wipe front to back, which for moms, because we have the same anatomy as female patients, it's less problematic for us as females to know to wipe front to back because we've been taught that our whole lives. But for dads or male parents, sometimes it's harder for them to realize that. So making sure you're teaching parents that and clarifying that, especially if they had they've only had boys and this is their first baby girl, or something like that. Wearing cotton underwear, that helps reduce the risk. The other synthetic kind of materials can actually increase your risk for reoccurring UTIs, because the material doesn't breathe as well. And then making sure that they're drinking plenty of fluids and not holding their urine for long periods of time. Taking frequent bubble baths is often a common occurrence for reoccurring UTI. Okay. So making sure you're avoiding bubble baths. Okay, when do you correct hypospadias of the newborn? Repairing the defect will increase the risk of testicular cancer. No intervention is necessary as the defect will correct itself over time. Corrective surgery is usually delayed until preschool age, and surgical repair of hypospadias is done before 18 months of age. Yes, good. It's done before 18 months of age because what can start at 18 months of age? What can kids start doing anatomically and physiologically? Potty training, right?
Yes.
Their body can actually physically do that starting at 18 months. Now, a lot of them don't figure it out, and parents don't want to attempt it until closer to 2 years of age, which I don't blame anyone, but for that. But physiologically, they can do that at 18 months. So that hypospadias repair needs to occur before 18 months of age. So that doesn't affect their potty training. Okay, good. Okay, foreskin is retracted and very tight on the shaft of the penis, unable to return it over the head of the penis. What's your action? Notify the charge nurse, place a warm compress on the penis, forcibly push the foreskin down over the head of the penis, or wait a few hours and try again. Notify the charge nurse, right? Because that kid's probably going to need surgical intervention. Okay. There's not much you can do. Pulling it back forcefully is not going to be helpful. Waiting a few hours, it's going to get worse. Okay. And a warm compress, once again, what's going to happen to the penis if you put warm compress? Those vessels, they're going to dilate, right? So it might worsen that scenario as well. Okay. If you guys have any questions, you can just unmute and ask. Okay. All right, which urinary diversion procedure is the least damaging to the body image of the adolescent? Urostomy, suprapubic catheter placement, nephrostomy, or ileal conduit? So an ileal conduit, that's because that's just like a little essentially a straw that then can be, wrapped up and hidden fairly easily. All of the others are pretty invasive, and they include like collection bags and collection systems. Okay. Okay. Which physical assessment will the nurse omit when caring for a child diagnosed with Wilms tumor? Performing a range of motion exercise on lower extremities, percussing ankles and knee reflexes, assessing bowel sounds, and palpating the abdomen, which would be skipped and not done in a patient with Wilms tumor. Palpating the abdomen. Can anyone tell me why that is? If you don't know, that's fine. I can tell you, but I want to see.
You could probably move it or like damage it.
Yeah,
Yeah.
so Wilms tumors are really fragile. So actually, if you palpate the abdomen, they kind of almost like pieces of the tumor kind of can flake off and then embed other places. So potentially you can kind of spread the and cause more damage by palpating the abdomen in a kiddo with Wilms tumor. Okay. So if you know that that child has Wilms tumor diagnosis, then do not palpate their abdomen. Okay. Okay, what is the probable cause of acute glomerular nephritis? Recovery from German measles 2 months ago, a sore throat 2 weeks ago, a history of allergy, or dysuria the previous night. A sore throat 2 weeks ago, because what usually precedes or happens before kids get glomerular nephritis?
They have strep.
They have strep, and usually they get their antibiotic for strep. They're feeling better after about 5 days, 6 days. They stop their strep antibiotic, their amoxicillin or penicillin, and then their kidneys, they don't totally get rid of the infection, and their kidneys do not like that. Okay. So it's usually after strep and when they haven't completed their antibiotic for strep. Okay, multi-select. What will the nurse caring for a newborn with extrophy of the bladder include in the care? Position the infant on their back, protect the skin around the bladder, cover exposed bladder with a shield, or diaper the infant tightly. So position them on their back and protect the skin around the bladder. So you do not cover the exposed bladder with the shield, okay? And you don't want to diaper them tightly. First off, because that can really put a lot of pressure on the bladder that's outside of the body, okay? Because that's what extrophy of the bladder means. It's external instead of being internal. Okay. Child is brought to the emergency department with burns on the face and chest. What is the nurse's first priority? Insert a Foley catheter, assess respiratory status, administer pain medication, or remove clothing. It's the first thing you guys are going to do if this is your patient and you're in the ER working. assess respiratory status because the burns are on the face and the chest. Okay. Good. Okay, multi-select. What should the nurse stress/teach to the mother of a child with impetigo? Small cuts and bites should be treated promptly. The lesions are caused by staph or strep. The condition is caused by herpes simplex virus type 1, or lesions are bullous. Okay, not caused by herpes, okay? Impetigo is caused by staph or strep infection. There's usually a small opening in the skin, and then that staph or strep that occurs naturally in our skin flora kind of accumulates to that opening. It's really opportunistic, and then it causes impetigo. The lesions are usually kind of bullous or blister kind of like, and then they pop essentially, and then they crust over, and it's usually like a honey, dry, crusted colored lesion that's on those wounds. So that's pretty classic impetigo. It's not always on the face, it can be on the body, can even be in the diaper areas. So anywhere that there's a skin opening and it gets that honey crusted lesion, and they looked bullous prior to that, then you're going to get concerned about impetigo, and they'll need treated for something that covers staph and strep. So usually it's bacitracin that they get. Okay. Or mupirocin is the other name for bacitracin. Okay. All right, another multi-select. Which factors activate herpes simplex virus type 1? Fever, sun, stress, or menses? Yep, all of them. So anything to throw your body off can potentially activate HSV type 1. And HSV type 1 is typically, your oral cold sores. But HSV type 1 can affect your genital region as well. Just like type 2 can affect your oral region. Okay. Okay, football players are taking oral griseofulvin for tinea pedis. What should the school nurse caution them to avoid? Citrus fruits and juice, taking corticosteroids, eating shellfish, or alcohol consumption. What do you avoid if someone's on griseofulvin? Alcohol, which they should be avoiding alcohol anyways because they're adolescents, but we all have been adolescents before. Okay. So that's the biggest thing. If people are on griseofulvin, it can be hard on their liver already. Okay. So drinking alcohol while on griseofulvin can worsen that risk of liver failure or damage. Okay. Good. Okay. What is the correct nursing response to a mother who asks, how can I get rid of my baby's cradle cap? Okay. Rub oil on the infant's head at night and shampoo the next morning. Lubricate the baby's head every morning with a small amount of olive oil. Use a bristle or use a brush with firm bristles on the baby head several times a day. Wash the baby's head every night with a dandruff control shampoo. Okay. They're going to rub that baby oil on the head and then shampoo it the next morning. And they can brush it with a soft bristle brush, okay? And kind of almost like scrub that area with the oil. You do not want to do baby oil, or excuse me, olive oil, because that actually feeds and worsens the cradle cap, or seborrheic dermatitis is the other name for cradle cap. Okay. So no olive oil, you do baby oil or mineral oil. Okay. And no firm brushes and no dandruff control shampoo, because it's not truly dandruff. Okay. All right, child has intense itching of the axilla and between the fingers and toes. It's worse at night. What is this? Tinea corporis, eczema, pediculosis capitis, or scabies? Talking about all these things make me itch. Okay, so it is scabies. So what gives it away is the intense itching at night specifically, but also in those areas. So like fingers, between the toes, between the axilla, like the groin region is another kind of common, like the buttocks is also another common place that scabies really like to be. Pediculosis capitis, obviously that's head lice, so that itching is intense no matter what time of day. And ringworm or tinea corporis, that's on the body, that's not always itchy. Okay, can be, but not always. And eczema usually isn't itchy until it dries out, then it gets a little itchy. But okay, an adolescent presents with a butterfly rash. What diagnosis should the nurse suspect? Tubercular sclerosis, systemic lupus erythematosus, eczema, or psoriasis? Lupus. Yep, good. Make sure I can see your guys' faces on camera, okay? Okay, multi-select. Which food sources are high in soluble fiber? Bran cereal, cooked vegetables, raw fruits, or beans? So, raw fruits and beans. Bran cereal is typically not as high in fiber, okay? And cooked vegetables, you essentially cook all the potential fiber out of the vegetables when they're cooked. So raw vegetables are higher in fiber, but beans and raw fruits have fiber. Good. Okay. Glycated hemoglobin, or hemoglobin A1C test, can evaluate average glucose levels over a blank to blank month period. 1 to 2, 3 to 4, 2 to 3, or 4 to 5. Three to 4 month period, okay? So your hemoglobin A1C that looks at your average blood sugars over a 3 to 4 month period. Okay, what occurs as a result of an inadequate secretion of insulin? Serum glucose levels are markedly decreased. Increased fat breakdown leads to ketonemia. Protein synthesis is increased, or more rapid conversion and storage of carbohydrates to glucose occurs. So, good. Increased fat breakdown that leads to ketonemia. So ketones in the blood. They also will have ketones in their urine a lot of times too. Okay, good. Child receives combination of regular and NPH insulin at 8 a.m. At 8:45, the breakfast trays still have not arrived yet. What would you do? Notify the charge nurse, give the patient a snack of graham crackers and milk, ambulate the patient in the hall, give the patient more insulin according to their sliding scale. Yep, give them a snack because they're going to be low, right? Good. Okay, child with diabetes is brought to the ER. He is flushed and drowsy. His skin is dry. Child is experiencing what? Water intoxication, ketoacidosis, Samogi's phenomenon, or Down syndrome. Ketoacidosis, yep, because it sounds like his sugar is high, right? Flush, drowsy, skin is dry. That usually happens in hyperglycemia. Good. Okay, a child with type 1 diabetes has hyperglycemia, diaphoresis, and headaches in the morning. What's the condition? Dawn phenomenon, ketoacidosis, Samogi phenomenon, or honeymoon effect? So that's the Samogi's phenomenon. Okay, so Samogi is going to be their high glucose in the morning, diaphoretic, and headaches in the morning. Okay, good. What is the function of an insulin pump? Releases insulin as blood glucose rises, delivers a prescribed amount of insulin twice a day, decreases the need for painful glucose monitoring, or provides continuous infusion of insulin. Okay, so it provides a continuous infusion of insulin. Now, obviously, if they're checking their sugar and their sugar is high, they can do a bolus of insulin, but those pumps do not automatically release insulin because your blood glucose is elevated. Does that make sense? That's why the red one was incorrect. So you just set it up to give kids a continuous infusion of insulin. And then they can add the demand dose or the bolus doses as needed. Good. All right, another multi-select. What signs and symptoms will alert parents to the possibility of ketoacidosis? Nausea, hyperactivity, chest congestion, or fruity breath? Nausea and fruity breath. Okay, kids will not be hyperactive if their blood glucose is elevated and they're ketoacidotic. What will they be?
Lethargic.
Yeah, usually they'll be laying around lethargic and fatigued. Okay, and they'll not have increased chest congestion. Usually it'll be dry. Okay, good. All right, another multi-select. Why are children more prone to insulin reactions? The condition is more unstable in children, the activities are irregular, sleep patterns are not established, or they are still growing. And this was a multi-select. Yes, good. The condition, so diabetes is typically more unstable in children. A lot of times it's not found until they're in decay or something like that. And they're still growing. So there's a lot of demand on their body to regulate itself so that way they can grow appropriately. Okay, good. What type of precautions are necessary with varicella? Airborne, protective, droplet, or contact? Airborne, okay. What is varicella? What's the other name, or what's the common thing for name for varicella?
Salmonella.
Chicken pox.
Oh, I'm
Okay.
sorry. I'm thinking of.
Nope, that's okay. That's okay. Yep, that's okay. So chicken pox. Chicken pox are super contagious. It's airborne transmitted. Okay. They can be transmitted for quite a period of time. So if a kiddo's hospitalized and they have varicella or chicken pox, they need to be in airborne precautions. Okay. Good. Okay. Which vaccine would be contraindicated for 18-month-olds with allergies to eggs? Influenza, inactivated polio vaccine, diphtheria, tetanus, pertussis, or hepatitis B vaccine? Okay, it's influenza, but I will put this caveat out there. It is no longer contraindicated because a lot of the influenza vaccines have transitioned to not including eggs and how they're developed. Okay. So for the purpose of the exam and for books, and your HESI and all of that, yes, influenza is contraindicated if kids have an egg allergy, but no, in the real world, that that's not as likely. And the book just hasn't caught up to speed yet with that. Okay. Any questions about that? But you can still ask if they have an egg allergy, because you would want to double check that your flu vaccines that you have weren't developed in eggs. Okay. Good. Okay. Child's rash is present on the trunk, extremities, face, cheeks were bright red. Which type of rash is this? Measles, rubeola, fist disease, or varicella? Fist disease. So that's that slap cheek. You guys have ever heard of like slap cheek appearance, where kids have really red cheeks? Now it doesn't come across their nose like it does in lupus. Okay. But just both cheeks are slapped cheek appearance, like someone smacked them in the cheek. And then a lot of times they have a generalized kind of lacy looking flat red rash on the rest of their body. It usually always spares their palms of their hands and their feet though. So they're not typically going to have a rash on their hands, on the palms of their hands or the soles of their feet. And fist disease is just a viral illness. Okay. Okay. Child in the prodromal stage of varicella. What does this mean? The child does not have varicella but has been exposed to it. The child is infected but not contagious. Child has varicella but has not broken out yet. And the child is now immune to varicella. Prodromal stage. Yes, the child has varicella but hasn't had the rash come out yet. So they are still contagious. Okay. Good. All right. When should hepatitis B vaccine be given to infants with born with a Hep B positive mother? Within 12 hours after birth, within 2 months after birth, within 1 month after birth, or within 2 weeks after birth? 12 hours. So typically most babies get their Hep B vaccine when they do all their lab work and all of that about 24 hours. But if mom is known positive for hepatitis B, then that baby needs their vaccine before 12 hours of age. Okay. Good. Because the goal is to potentially reduce the risk of transmission. And by doing it earlier, that should give them some antibodies to fight against the Hep B. Okay. Okay. Which classification of medication would make a child most susceptible to an opportunistic infection? Beta adrenergic agents, corticosteroids, antibiotics, antivirals. Corticosteroids. Yep. Kind of already talked about that. But if kids are on steroids or corticosteroids, they're going to be more at risk for getting an opportunistic infection. So something like staph, strep, things like that. Okay, last question. Multi-select. What sources are examples of acquired immunity? Immune globulin, vaccines, gamma globulin, or the disease? The vaccine and the disease, those are acquired. The immune globulin and our gamma globulin, we have naturally, right? So those are going to be our innate immunity. And acquired immunity means we have to get it or get the vaccine to then become immune. Any clarifications on that one? No? Okay. All righty. Good job with that one. Okay, we're gonna go to the PowerPoint now.
I sent you a message.
Okay, yeah, let me look. Okay, Tamika, I see your message. Okay. Can you just, Kiara, can you message me, or Kira, can you message me what's going on? I had the PowerPoint up, now it's went away. So give me just a second here. Okay, PowerPoint is coming up. You guys need to run to the bathroom or whatever you can. Just make sure you get right back on camera. Okay. Okay. Let's share my screen again here. Okay. Are you guys able to see the PowerPoint now? Oops. So we're going to start with GU. Okay. Okay. So this is chapter 29. This will be on your exam next week. So make sure you know the material. Here's your objectives. These will also help you kind of figure out what all you need to know as well for exam purposes. Okay, assessment of urinary function. So these are all urologic tests or procedures that can be done to look at the function of the urinary system. So a UA, obviously that's just the kiddo has to go pee, and then a urinalysis is done of that to look at if they're spilling glucose or protein or if they have a UTI, okay? An ultrasound of the bladder, that can be completed if you're concerned of there being some sort of issue with the anatomy or the bladder itself, okay? IV pyelogram, so that is there's contrast given, and then it flows through the kidney, and you can kind of watch that contrast go through the kidney. CT, that's just looking at the kidneys with the CT. Sometimes contrast is given in that point as well. Biopsy, that would be taking a sample of the bladder or the kidney to see what's going on at the cellular level. Like if you're concerned about a cancer or something, if there's a tumor on the kidney. Uroflow, that's looking at the flow through the urine pathway. Okay, so that looks through the ureter, the kidney, and through the bladder and through the urethra. Cystoscopy, that is a little camera essentially that's on the tip of a catheter that's inserted to look internally at the bladder a little more closely. Avoiding cystourethrogram, so that is they are looking with that little camera and they actually have them void during that time. Urethral pressure, that's looking at the pressure in the urethra. And then a cystometogram is the pressure in the bladder itself. Okay. Okay, so common terms for urinary dysfunction. Dysuria. This means difficulty with urination. Okay. Can be painful urination. Frequency, that means they're having to urinate frequently. Urgency means when they get the urge to go pee, they have to pee right then, okay? Nocturia is peeing at night, okay? So frequent urination at night. Enuresis is going to be accidents, urinary accidents, okay? Polyuria means frequent urination and peeing a lot each time. And oliguria is, oh gosh, why am I blanking on oliguria? It is decreased urination, okay? All right, so phimosis, this is what we were talking about when the foreskin would not then retract over the penis. Okay, so this is a narrowing of the prepubertal opening of the foreskin. It prevents it from being retracted over the penis. How it's corrected is by doing a circumcision. Okay, forcible retraction can lead to paraphimosis, which causes more damage. Okay. The foreskin then, after you forcibly retract it, cannot be returned back normal over the head of the penis. And then swelling and impaired circulation can occur. Okay. So you want to make sure that if they have phimosis, you're not trying to just rip it back. Okay. Hypospadias and epispadias. So epispadias is the urinary meatus is on the top of the penis. So you can see this picture here. Hypospadias is on the underside. Okay. So it's a congenital defect where the urinary meatus is on either the upper portion or the lower portion, depending on the defect, depending on if it's hypospadias or epispadias. Okay. Maybe accompanied by a chordate or a fibrous strand, which causes a downward curvature of the penis. Okay. So surgery is not indicated if it's a mild case. So like if it's just that the urinary meatus isn't right in the center of the penile head, it's like a little bit lower, so like if it's like right here, then they may not do surgical intervention, or if it's like right here, then they might not do surgical intervention. And like we talked about in the cahoots, surgery is performed before 18 months of age. And then they typically do not do circumcision in these kids with hypospadias or epispadias because they use the foreskin to do the repair. Okay. And you can see here how they do the repair. They usually insert a something similar to a catheter. It's essentially like a needle or like an opening that's created, and then they suture the abnormal opening, and then they create an appropriate penis and an appropriate urethral meatus. Okay. Extrophy of the bladder. So this is when a portion of the abdominal wall contents are outside of the body. So this is usually noted on fetal ultrasound. So when baby is within mommy's belly, they still know usually that there's going to be extrophy of the bladder prior to birth. Of course, there's those rare cases where they don't realize that until birth. So the bladder is open and exposed on the abdomen, and you can see that here. It's continual leak of urine from the bladder, which then causes skin excoriation. The bladder is covered by a protectile mucosa, and it's meant to keep it, moist like it should be within the abdomen. They place a diaper under the infant instead of on the genital area, or on the area where you would typically put a diaper on a kiddo. They should be on their back or their side, so that way the urine is allowed to drain freely. And they're usually closures performed surgically at about 48 hours after birth. Okay, so these babies are going to have pretty early intervention. Obstructive uropathy, which is like kidney stones, okay, or tumors or narrowing or scarring. So this can cause hydronephrosis. So if there is a kidney stone in the way in the ureter, then it's going to backflow into the fluid. The urine can't get past that kidney stone. So what's going to happen is going to backflow into that kidney, and then you're going to get the hydronephrosis. So the enlargement of that kidney. This also commonly happens in people with polycystic kidneys where they're going to have the hydronephrosis, but they're also more likely to have tumors or strictures, so narrowing or scarring in that kidney pathway, or within the ureter, that then causes them to have hydronephrosis. If these obstructions aren't resolved on their own, then they have to go in and do a diversion surgery, which usually includes then a urostomy. Okay. So toddlers will likely not be able to potty train, okay, if they have an obstruction that then leads to them needing to have a urinary diversion. School age kids may have some body image struggles, like with comparing themselves to other kids. But adolescents likely will have self-esteem struggles and also concerns about sexual activity and sexuality related to that urinary diversion surgery. Okay. But either way, it has to be resolved. Okay. Okay, critical thinking question. The parents of a 4-year-old boy explained to the clinic nurse that for weeks, the child has been irritable, listless, and even though he has developed a poor appetite, he has still gained weight. What signs and symptoms should the nurse look for? What condition should you expect? What are nursing interventions and parent education that's appropriate? Okay, so what would be the symptoms or signs that you would look for in this question or in this scenario?
If the child have like some type of swelling somewhere.
Yeah, because he's not been eating, right?
Right.
But he's still gaining weight.
He's
Irritable and listless. Mm-hmm.
What's that word? I keep seeing that word. Listlessness.
Listless. Yeah, so that's like it's similar to lethargy, so being lethargic, but it's kind of
Okay.
the following step after. So it is like they're not very responsive, they don't get very worked up about things that they should be getting worked up, like procedure, like like typical painful, scary things. They just kind of lay there and let you do it. That is what listless looks like or is. Okay. Okay, what condition would you guys expect with this kiddo? I think Latricia kind of already said it, like an obstruction, a form of an obstruction, right? Because we're gaining fluid. So there's something going on likely with their kidneys that they're holding on to fluid. So what would be some interventions that you could do as a nurse?
You can do that bladder scan to see if that's urine that's holding on.
Yeah.
And if it is, I don't know if kids, did we say anything about them getting, do they get catheterized or catheterized?
Yeah. Not a lot, right? Because that's something that's kind of traumatic. But in a kid like this that's holding on to fluid, and you really need strict INO, right? Then the catheter might be appropriate. Typically kids are more likely to be straight cath than have like an indwelling catheter. Okay. And parent education, that would be appropriate. Then if this kiddo is going to have some sort of chronic kidney issue, what sort of things would you teach parents about?
Drink a lot of fluids.
Yeah. Making sure that they're urinating, right? Keeping an eye on their weight. If their weight's going up, they're holding on to fluid. That kind of gives parents a clue that there's something going on that's causing them to hold on to that fluid.
Yeah. Or in measuring their eyes and nose and stuff.
Yep. Good. Perfect. Anyone else have anything else to add? Any other thoughts? No? Latricia got it all? I think she did a very nice job. Okay. All right, here's your next set of objectives. So things you guys need to be knowing, okay? This will help guide your studying as well. Okay, an acute UTI, acute urinary tract infection. It's obviously more common in girls because of our anatomy. Our urethras are shorter. Our urethra also is closer to our anal opening or our anus. We usually wear more nylon-based underwear, which places us at increased risk for UTI. Women prefer typically bubble baths over men, so that's an increased risk. And we also, because of our vagina, we have that vaginal bacteria that's normal, but that also places us at an increased risk for UTI. Okay, most common trigger of UTI is E. coli. Okay, and the goal is to have acidic urine. So your goal to prevent UTI is to encourage those kiddos to have more acidic urine. And like we talked, cotton underwear, avoiding bubble baths, making sure they're wiping from front to back. Now that's common with preschoolers or school age kids that you don't help them any longer wipe, making sure to teach those kiddos that. Okay. If the urine is alkaline or more basic, it's going to favor pathogens, which is going to place kids at more increased risk for UTI. Okay, signs and symptoms based off of UTI, that depends on the age of the kiddo. Babies, they're going to have fevers, they might have vomiting, they're not going to want to eat, they're going to kind of lay around. Toddlers, same thing, they might cry when it hurts, or when they're going pee because it hurts. Okay. School age kids, they'll be more likely to be able to tell you, you know, it's burning when I pee, it hurts to pee, I don't want to go pee. You know, they're more likely to communicate those things with you. And adolescents, you know, they're more likely to know what's going on and know that that's abnormal as well. Okay. Infants less than a year usually are hospitalized for IV antibiotics because it's, you know, a little bit less common for infants to have UTIs. Okay. And it's more risky as well. Older children are usually attempted to treat them at home, at least with oral antibiotics first. And the parent teaching, obviously you're going to stress fluids and maintaining sterility and flushing the bladder. Okay. So making sure that those kiddos are drinking plenty of fluids, they're going pee normally and appropriately. And then making sure also that, you know, they're not taking bubble baths every night or things like that can be more irritating to the urinary tract. Preventing UTI, we kind of went through all of those things, but there's another list. Also, like infants, if parents or daycare or something like that are letting them just kind of sit in their diaper, their wet or stool diaper for long periods of time, obviously they're going to be more at risk for getting UTI because that bacteria is just sitting in that area and hanging out and at risk for then being opportunistic. Okay. So teaching parents about that. I have a little message here. Okay. All right. So nephrotic syndrome or nephrosis. Okay. Look at these kiddos. They are holding on to fluid. Okay. Their kidneys are not functioning appropriately. They're holding on to fluid. So this happens because there's a huge loss of protein in the urine. It then leads to swelling, generalized swelling, and low albumin in the blood. Remember on our Kahoots, one of the questions was high albumin in the blood. It's low albumin in the blood with nephrotic syndrome. And they're going to have low proteinemia. Okay, so hypoproteinemia. and they're going to have hyperproteinuria because they're spilling that protein out. Okay. Because they're spilling that protein out, they're going to hold on to their urine. So they're going to be more edematous generally. Okay. They're also going to have higher lipids, so higher fat in their blood. Okay. It's more common in boys than girls, typically seen like 2 to 8 years old. Sometimes it is related to thymus T cell dysfunction, so kind of an immune regulator cell. They're going to be pale, they're going to be irritable, they're going to be listless, okay? Poor appetite, their blood pressures typically, even though they're holding on to fluid, are normal until they get really significantly fluid overloaded. And on the urine, you're going to see a huge amount of albumin. Their albumin is going to be sky high, and they're only going to have a few red blood cells in their urine. Okay. Kids can eventually get neutropenic from nephrotic syndrome. So you get worried about those kids potentially getting infections if their absolute granulocyte count or neutrophil count falls below 1,000. Okay. So if they're ANC, that's another word for it, falls below 1,000, kids are going to be way at risk for infections. So to treat nephrotic syndromes, steroids are given to reduce proteinuria and the edema. Also, steroids can mask infection, so you want to continue to monitor that kiddo for signs of infection. Okay. Going to prevent med toxicities. So sometimes taking too many medications can cause nephrotic syndrome to occur. Diuretics are not helpful in reducing the edema in these kids. Steroids is what's going to help because you have to figure out the protein spillage first before the edema will resolve. Okay. Avoid salty foods because edema is present, just like with adults. We do not fluid restrict kids typically unless they have like massive amounts of edema. Okay. And you're going to make sure that parents are documenting or letting you know their weight and their urinary protein levels and the medications that they're on. Positioning wise, how do you think that you would position this kiddo?
Semifinals?
Semifowlers, yeah, that could be helpful, right? Because then they're not like straight up to where all the fluids, or they're not laying straight flat, which all the fluid then accumulates, right, more in their face that way. Yep, good. You're going to still have strict INO. That's going to be across the board with urinary stuff. That's going to be your thing that you do with any condition is monitor very strict INO. And then of course, because they're being treated with steroids, we're going to prevent protection from infection. And then also we're going to delay live vaccinations. Okay. Okay, acute glomerular nephritis. This is a type of an allergic reaction. It's an antigen antibody allergic reaction to group B strep. So what happens is that body recognizes the kidney tissue, the glomerular tissue, as something that it needs to attack and fight after strep, essentially is what happens with glomerular nephritis. Antibodies are produced to fight the invading organisms, but they're fighting the regular glomerular tissue instead of fighting the organisms. Okay. Usually both kidneys are affected with glomerular nephritis, and usually if it's fairly mild, it resolves within a couple of weeks and kids don't have long-term effects on their kidneys. But if it continues much longer than a couple of weeks, then they can face long-term effects. Okay, Someone other than Latricia is going to talk about this question with me. So whoever wants to unmute and talk. Okay, an 11-year-old girl has been diagnosed with a UTI. What key points should the nurse teach the patient and her parents about treatment of the condition?
Complete all medication as prescribed.
Yep. Do their medication.
To wipe front to back.
Yep.
Education on what type of underwear to wear, the cotton underwear.
Yep.
And teaching them no bubble bath.
Yep.
Yeah,
Good.
bubble baths was the problem when my oldest daughter was younger.
Yep.
I didn't realize it caused UTIs.
Yep.
And that was like the trick to getting her in the tub when she was like in that stage where,
Yeah,
no,
she
I
didn't want
wanted
to
to,
bathe.
yeah.
Yeah.
And then we ended up with a lot of UTI.
Yep. What's another thing that you get concerned about if kids have UTIs, frequent UTIs?
Under other conditions like HIV and things like that? Or is that
Yeah,
what adult?
like immune suppressing conditions potentially. Yep. What else? What's another potential cause that
Right?
yes, assault, sexual assault in any form. Okay. So you get concerned about that. If kids are coming in like a lot with UTI, that's something that you guys as nurses should have in the back of your mind always. I know it's sad that that's what we have to think about with these kids, but it's more common, unfortunately, than you would think. Good job.
That's something I always think about, especially being a mom of girls and having
Yep.
been through it. It's something that like is always on your mind, like, oh, well, why are they acting different? What happened?
Yep. All right, more objectives there. Wilms tumor. So we talked about this a little bit in the Cahoots. So it is an embryologic adenosarcoma. Okay. It's thought to have a genetic basis. It's mostly discovered before age 3, and it's one of the most common malignancies in early life. Okay. They have few to no symptoms typically during the early stages of tumor growth, but then eventually the abdominal mass is found by a parent or found during a routine health exam. Okay. Wilms tumor is also referred to as nephroblastoma. Okay. So nephro, that'd be kidney cancer, right? It's usually just affects one kidney, but in about 5% to 10% of cases that can affect both kidneys. Okay. They eventually will have hypertension from the tumor. And usually they figure it out via like they find the abdominal mass and then they start like they do a CT or something like that. And then they do an IV pilogram that looks at the growth of the tumor and how much of that kidney tissue is affected. Okay. Usually when it's affected, it's encapsulated with the tumor. Okay, until the tumor is out of the abdomen, we do not palpate the abdomen. That's the biggest thing with Wilms tumor, okay? A sign above the bed to make sure that people are not palpating on the abdomen is usually recommended, okay? People should know what's going on with the patient, but the safest thing to do is put a sign up saying no palpation of the abdomen, okay? So treatment is usually surgical and chemotherapy and radiation with these kids. The affected kidney and tumor are typically removed as soon as possible after a diagnosis is confirmed. So preoperative care, you're going to do pre-op things typically just like you do with any kiddo, but instead of on your pre-op assessment palpating the abdomen, you do not do that. Making sure that parents aren't pushing on the belly or something like that too is also important, teaching parents and caregivers to not be pushing on their belly. And then you're going to have routine post-op care for these kiddos. And you can see this tumor is likely on the right side of the patient. okay, because their belly's protruding kind of in an abnormal way. So if you as a nurse see a kiddo who's pretty little and they have a really distended belly and it's protruding specifically in one side, and they've, not been eating as well or kind of more fatigued and things like that, then you might be more suspicious about that kiddo having a Wilms tumor. Okay, hydrocele. So this is excessive amount of fluid in the sac that surrounds the testicle. Okay. Causes scrotal swelling and chronic hydrocele that persists beyond a year. So they notice it, and if it continues a year past them noticing the hydrocele, then it needs to be surgically corrected. Sometimes hydrocele, the fluid is reabsorbed and it resolves on its own, okay? But if it continues after a year, then it's considered chronic and it needs resolved. Okay, cryptorchidism. So this is when the testy does not descend into the scrotal sac like it should. Okay, so it remains up in the abdomen. Typically, it's one side that's affected. Okay, it's not usually both, but it can be both. So testes are warmer in the abdomen, so the sperm cells then begin to deteriorate. So these kids are typically going to have struggles with fertility. Okay, even if it's resolved fairly early in life, then it's a little less likely to have long-term effects on their fertility, but there's still that potential that it could affect. Okay, obviously, if both testes were involved, then sterility can definitely be a factor. Usually, if kids have undescended testicles or they have cryptorchidism, then they also have an inguinal hernia. Okay, it's not uncommon that both of those things happen at the same time. It doesn't always happen that way, but that's fairly common. So just kind of know that as a nurse. And then testes continue to secrete hormones directly into the bloodstream. So secondary sex characteristics are not affected. So their penile development, their scrotal development, all of that should progress as normal. Okay. Cryptorchidism treatment is going to be surgical treatment, okay, if it does not resolve. Also, these kids will get HCG given or human growth hormone, okay? And then they usually try that before they do the surgery, okay? Eventually, if the surgery or if the HCG does not work, then they will do surgery. It's not uncommon that sometimes the testis can attempt to descend again, okay? So in that case, they usually do orchoplexy, which is then removing that testicle, okay? So they'll remove that testicle completely, okay? Kids who had cryptorchidism are at an increased risk for testicular cancer later in life. So in late adolescence from 15 to age 25 is their increased risk for testicular cancer. And kids who had cryptorchidism are more likely to have struggles with testicular tumors. So making sure you're teaching the babies or the kids that have an undescended testicle that to be checking themselves during that time period, okay? So your nursing care post-operatively is going to be scrotal support, okay, avoiding contamination of those sutures, right? Still in an area where they could be stooling in their diaper and they could be getting contaminated. Teaching testicular self-exams when they get older, and physiological and emotional support, okay? Think about if you had to have surgery on your private area, that would be fairly embarrassing to you, okay? And the nurse needs to also reassure that child that their penis will not be affected. Okay. Okay. Impact of urinary or genital surgery on growth and development. Okay. So between ages 3 and 6, kids are pretty curious about sexual differences. Okay. And they may masturbate, and that's okay. It's not to be overly concerning. Okay. They're curious about that area. And surgical intervention during this stage really needs a lot of guidance and prep. That way they don't have a lot of fears about the negative impact on their growth and development in that area. Okay. Okay, another critical thinking question. During routine monitoring of a 6-year-old who underwent renal surgery 24 hours earlier, the nurse notices a temperature of 102. What should the nurse suspect first?
Infection.
Yes. And what would be appropriate interventions of this kiddo?
An antibiotic.
Potentially, right? If they're found to have some sort of infection that needs an antibiotic. What else?
Encouraging fluids.
Yep. Potentially, right? They're not going to have to go back into surgery and have something revised.
Would you tell the provider since they're post-op?
Yep. That's going to be the first thing you guys do. They just had surgery, they have a fever. Call the provider. As long as they weren't like, all snuggled up in 15 layers of blankets that caused their fever. Call the provider first. Okay. They'll likely want a full set of vitals, making sure that they're not hypertensive or hypotensive as well. Okay, so make sure anytime you're calling the provider about a patient, you have a full set of vitals. That'll be one of the first things that they ask you guys. Okay, especially on a post-op patient. Good. All right, we're gonna move on to skin conditions. Okay. So this is chapter 30. Here are some of your objectives to keep an eye on as you're reading and as you're studying. Okay, so skin development. Your integumentary system is the biggest part of protection against outside defenses, illnesses, and diseases, okay? It prevents harmful chemicals and physical agents to affect your internal organism or your internal organs, and also it helps to prevent fluid loss and electrolyte loss. It can repair itself. Obviously, you guys get a cut, it scabs up, right? It stops bleeding, and the skin kind of repairs itself from the inside out. Okay. The ability. Also, kids cannot fully perspirate, so they can't fully sweat until age 3. Just so you know, that's kind of an interesting little fact. Okay. Okay, so skin disorders and variations. So skin conditions can manifest as a symptom of a systemic disease or process, okay? Others can be skin conditions that people have been born with. And skin color is an important part of your assessment, okay? Can help you diagnose certain diseases or be suspicious of certain diseases. Skin tests can also be used to diagnose kids with allergens, okay? So that's like a skin prick test where they inject a bunch of allergens in kind of a graphic kind of pattern, rows and columns on your back to look at what allergens you guys could potentially have reaction to. And hair is also a part of the integumentary system, and that can be a factor in some of these skin conditions, okay? So hair and skin can be affected based on nutritional status or certain medications or medical treatments. Okay, so when looking at skin disorders and variations, You're going to look at the size of the rash or the size of the condition, the color, how it's configured, how does it look? Is it generalized all over the body? Is it just on the face? Is it just on the abdomen? How it's distributed? Is it raised? Is it itchy? Is it flat? Okay. And the condition of the skin then around those lesions, is that really red as well, or is it just kind of, looking like normal skin? Also, obviously with skin rashes, itching can be a component, and making sure that kids aren't itching because you get concerned about there becoming a secondary infection because of that skin opening and itching it and continuing to kind of open and irritate that skin further. Likely kids will be on different skin creams or ointments, okay? And then the goal of those skin creams and ointments typically is to not only help kind of moisturize the skin and treat the condition, but also prevent secondary infections. Okay, so here's a description of skin conditions. So a macule is going to be a flat rash, okay? Can be something like freckles, or it can be just a flat, not raised rash. A papule is going to be an elevated rash, okay? So if you feel that rash, you run your hand over it and it's elevated at all, it's going to be papular, okay? If you feel that rash and it's flush with their skin, it's going to be macular. A vesicle is a fluid-filled blister, okay? So that's typically how cold sores and chickenpox start. A pustule is going to be pus-filled or kind of discolored fluid-filled, okay? So that's going to be more like acne or the start of impetigo.
For a vesicle, is more like acne.
No, pustule. A vesicle is cold sore, or so that's more clear fluid filled blister is a vesicle. If it's discolored fluid within that raised lesion, then it's going to be a pustule. Okay, a crust is another form, fancy word for scab. A wheal is a red, raised, irregular lesion. So you're going to be more suspicious of like hives, so an allergic reaction, or mosquito bites, because that can cause an allergic reaction for a lot of people on the skin level. Ecchymosis is going to be bruising, okay? So that's an important skin condition to keep track of as well. Okay, a sty, so hordeolium is the other word for this. This is inflammation of the sebaceous gland, so the sweat glands of the eyelid, okay? It's fairly common in infants and children. It can be painful, okay? But they do not need antibiotics for styes. Usually what's most helpful is actually warm compresses, okay? Eventually that inflammation will resolve on its own. It's important to tell kids to not be messing with it, like with their finger, because you could then get at increased risk for getting conjunctivitis or something like that, to where then they do need an antibiotic eye drop or cream, okay? But typically styes resolve on their own. Strawberry nevus, so you can see here's kind of the difference. They've had laser treatment on this hemangioma, is another word for strawberry nevus. So they get laser treatments, and then you can see kind of the resolution and the improvement of that hemangioma. So it's a bunch of dilated capillaries within the dermal space is essentially what a hemangioma is. Usually can go away without treatment, but some parents, it's really bothersome to them. So they will do sometimes some topical beta blockers like Timitol or laser treatments to that area. May not be something that you notice right away at birth. Sometimes it takes some time to notice the hemangiomas. So reassure parents that, if they start to develop, that it was actually truly there at birth. We just couldn't see it yet. It usually starts as kind of a flat red spot, and then it can progress to become raised and elevated and bright red like these two. Okay. A port wine stain or a port wine nevus, this is going to be something that you for sure notice at birth. Still, the dilated dermal capillaries, these are going to be flat. Okay, they're not going to get to the point where they're raised, and they're going to be more purple pink, whereas the strawberry nevus, you can see they're more kind of bright red. It's kind of hard to see in pictures, but these are more purple pink. Okay, and they become more dark purple as that child grows and gets older. They can do laser treatments to this as well. Okay, skin manifestations of illness. So cafe au lait macules or cafe au lait spots, that's what these are. So when kids have light oval brown patches, or they have multiple of these cafe au lait spots, you get concerned of a chromosomal abnormality called neurofibromatosis or tubercular sclerosis. So if kids have more than one cafe au lait spot, there's a certain criteria of how many and where they're at for if you're sending them to geneticists. But typically, if they have more than 2 or 3, or their one is really large, then it's good that kiddo is going to go to a genetics doctor, okay, to make sure that they don't have neurofibromatosis or tubercular sclerosis. Hypopigmented macules, those can be whitish oval shape. Those, if there's multiple of those, and you can kind of see that on this kiddo's skin right here, and you can kind of also notice it on that side as well. And they have a couple right here. It's hard to see in pictures always, but with this one is a pretty good picture. So if they're having multiple macules, they need to also see a geneticist because you get worried about tubercular sclerosis. Okay. Butterfly rash. So that is, like I said, over nose and cheeks. Just here, you can see that picture. That's going to be associated with lupus. These kids are also going to be have sun sensitivities. Okay. So that rash will get a lot more red if they're out in the sun without sunscreen specifically. Scaling skin eruption. So this usually happens around the mouth in a horseshoe shape first. You can also see it on the cheeks and the chin and the perianal area. It has papules and scales, so raised rash, and then also kind of a flat, scaly feeling rash. And it is associated with zinc deficiency. Okay. A lot of times kids with zinc deficiency also have not only this rash, but failure to thrive and diarrhea. So if kids have, you can obtain a zinc level, and if it's deficient and they're low, then they need replaced. A vascular birthmark. So these are some hemangiomas around the skin, or vascular birthmarks. Over time, they can become less apparent or they can become more apparent. It just kind of depends on the severity of the birthmark. And then if they have hemangiomas like around, like on their neck or by their face, then you're going to get concerned about potentially that hemangioma, that collection of those capillaries can be not only external, that you see them external, but it can also become more prominent internally. So then you get concerned about airway. Okay. Also, if the birthmarks are on their back region, you can get concerned about them having spinal conditions as well. Okay, so a female adolescent with port wine stain nevus, since early childhood, now has severe acne. She doesn't understand why she's susceptible to these skin disorders, and she asks whether she has done something wrong. How would you respond, and what advice would you give her?
Explain to her like what type of, is this a genetic skin disorder? And if it is, like explain to her
It's not
how she can
necessarily genetic, but it's something that she's born with, right?
well
So,
congenital,
mhm.
and just let her know that that was a condition she was born with, and like I guess give her different uh with how I'm trying to say, would different face routines work? Would she need to try different face washes and
Potentially,
things like that?
right, because their skin's going to be more sensitive. But if you have
Use a
a skin
sunscreen or
condition
something?
already, right, you're going to be more susceptible to having things like acne or eczema. So obviously, it's not her fault, right? And just explaining to her what types of things she can do. So, like making sure she's washing her face in the morning and at night to help reduce her risk of acne. But also talking about the fact that that's a pretty normal adolescent condition as well. But she kind of has not only the port wine stain, but also the acne. So she's kind of got to make sure she's really managing her skin in an appropriate way. Also, like putting on loads of makeup in kids with port wine stains or any skin condition is not the most helpful thing. But I understand that, people really, may want to reduce their appearance of their port wine nevus by utilizing makeup, but making sure that those kids are washing their faces at night, washing all the makeup off. That can also reduce their acne. But essentially reassuring her that it's not her fault. Good. All right. Infections. So miliaria, this is prickly heat rash. It's caused by usually body heat and moisture. Sweat is retained in that sweat glands and then they become inflamed. Leakage of potentially those sweat glands if they become really inflamed and enlarged with fluid, that can help, or that can happen. But they're tiny pin-sized raised red papules, okay? Sometimes they're itchy, sometimes they're not. Most common on the back, diaper area, or other skin folds, okay? So make sure that if this kiddo is all bundled up when they have this rash, you kind of maybe take off their multiple layers of clothes. You can bathe them, making sure that they have frequent diaper changes and skincare, okay? That they're not using some fragranced, irritating skin like soaps. Enrico, so this is chafing. This is a dermatitis that occurs most commonly in the skin folds. It becomes very red and angry, and then it gets activated and agitated by urine, feces, heat, and moisture. Obese children are more likely to have enorigo just because they have more skin folds, okay? And the prevention is keeping these areas dry and clean. So like this kiddo might be one that you need to utilize baby powder, okay, in those skin folds to help it with decreasing the moisture. Seborrheic dermatitis or cradle cap. This is what this looks like. It can be on the face, okay? So if you have a baby that looks kind of scaly, crusty like this, then you're going to be more suspicious of cradle cap. It's inflammation of the skin that involves the sebaceous gland. So it's going to be that thick, yellow, oily, crusty, scaly looking appearance, usually on the head, scalp, forehead, can also be on the ears or kind of behind the ears. Can commonly be seen in, you think of newborns, cradle cap, but also can be seen in adolescents. So making sure that they're shampooing their hair consistently. And this will not be bothersome to these kiddos, okay? Now, if it happens in adolescence, it's going to be bothersome to the appearance, but it's not itchy or anything like that. If it's itchy, then you get more concerned about it being eczema. Diaper dermatitis, you can see here, it can get really bad. It can happen if, as you're introducing solid foods, kids can start to have diaper rashes, feeding, chemicals, changes in diapers, changes in wipes, but they're going to have a really beefy red infection usually in this area. And if it's reflecting, like if it's very symmetrical on both sides and also beefy red, you get concerned about them having a yeast infection or a candida affection. Okay. So keeping that area dry and frequent diaper changes is going to be your biggest improvement in reducing your risk for diaper dermatitis in these kids. If they have a candida infection, then they need antifungal like nystatin. Okay. And obviously, if it's starting from, like, parents had just switched diapers brands or just switched wipe brands, then they need to go back to what they were using before. Acne vulgaris. So this is inflammation of the sebaceous glands and hair follicles. Okay. Our sebaceous glands and follicles enlarge through puberty, so then that increases the sebum that is secreted, okay, in that area, and then what happens is it blocks those sebaceous ducts. Okay. Komedo is a plug of keratin, sebum, or bacteria, so that's acne. And open komedo is going to be a blackhead, okay, so blackhead acne. And then closed komedo is going to be like your classic pus-filled whitehead, okay? Routine skin cleansing, avoiding greasy hair products, or continuing to put makeup on these areas when they're already irritated skin going on. Excessive cleaning, like so cleaning all using your facial like salicylic acid face wash frequently, so more than twice a day, that can actually worsen and further irritate your skin. These kids might have topical or oral treatments for their acne, okay? And it's important to stress to teenagers to follow their medication treatments as prescribed, okay? That's a big struggle with teenagers. If any of you guys have teenagers like at home, you all know about that, I'm sure. To get them to do much of anything can be a struggle. Okay, herpes simplex type 1. This is a cold sore or fever blisters, usually tingling, itching, burning on the lip prior to seeing that vesicle. Then the vesicles form and then they crust over. It takes up to 10 days to heal. Usually, they're kind of in a little group cluster. It's not usually just always one vesicle. If you catch it really early, it can be just one vesicle. And recurrence is likely going to happen, okay? And you treat with oral antiviral medications or topical antiviral medications. Okay, infantile eczema, you can see this baby here. So it looks similar like we talked about with seborrheic dermatitis, but it's going to be more red and it's going to be itching. So atopic dermatitis is another form for eczema, or another name for eczema. It's inflammation, typically from hypersensitivity. So it's going to be allergic driven, okay? So kids who have eczema need to see an allergist. like always, okay? Because it's almost always caused from some sort of allergen. Okay. So what happens is there's vasodilation in those affected areas, and then there becomes a breakdown of those dermal cells, and then it forms the intradermal vesicles. Okay. Rarely seen in infants who breastfeed. Okay. But it commonly starts when those breastfed infants start eating usual foods. Okay. It's always worse in the winter. Okay. It's more of a symptom versus a disorder. Okay. So it's a symptom of an allergy that's going on, an allergic kind of thing that's going on. These lesions, because they're often itchy, kids will scratch at them and then they get secondary infections. Okay. May flare up after immunizations because that immune system is kind of already in overdrive with dealing with the vaccine, and then it leads them to be more susceptible to an eczema flare-up. If you do blood work on these kiddos, they're going to have increased IgE, which is the allergy immune globulin driven, okay, and increased eosinophils, which also goes along with allergens. So the biggest thing about these kids with eczema is they need to see an allergist. They're going to typically be on corticosteroid creams, antibiotic creams, and an anti-itching cream. Okay. Emollient baths, like adding oatmeal or baking soda to their bath, can be ordered. Also, recently, they've been talking about bleach baths, which sounds crazy, but it does help with drying it out. And it's a tiny amount of bleach in the bathtub. And the goal is reducing the inflammation and the itching and hydrating that skin. Okay. So, applying like Vaseline or bath oils or really good hydrating lotions right after a bath is really important. You don't want these kids to totally dry off. You want them to be a little bit wet still while you're applying these creams. So that way you can lock in that moisture. Okay. Parents should be wiping off the ointments completely if there's resolved ointments left over. Corticosteroids should be avoided for long periods of time because of the risk of thinning of the skin. Okay. To do their topical medications, they're best absorbed after warm baths. Okay. You want to apply them in the direction that the hair grows and making sure that they have a proper amount of the ointment to hydrate that skin. Okay. Sometimes elbow restraints are used if that kiddo is really scratching often and causing a lot of secondary infections. Okay. And if there's concern that there's a viral infection that's going on or a fungal infection, you should not use steroids because it can worsen. Okay. We'll finish this page and then you guys will be free to go. Okay. So staphylococcal infections, primary infection can develop from that child's this circumcision wound or their umbilical wound. Okay. This can occur when they're in the hospital or if they're discharged. And with staph infections, the biggest concern is that bacteria entering the blood and then becoming septicemic. Small pustules, if you find anything like little pustules, so raised, pus-filled lesions, those need to be reported right away to that provider. Antibiotic ointments are used in some of these situations, but IV antibiotics and staph infections, especially in young children, are always needed. Okay. An infant will then be swabbed likely for MRSA, right? Because that's the most problematic, one of the most problematic forms of staph infections. And if it comes back positive that they have MRSA, they will be placed in isolation, contact isolation. Okay. All right. we're going to stop here, okay? Make sure you guys finish reviewing that PowerPoint, okay? Any questions before we hop off? No? Remember, there are exam reviews. Mine will be at noon today. Okay. Anything else that anyone needs?
Yours at noon, like yours at 12 o'clock?
Yep. Yep. So I'm going to take a quick break, eat a little something, and then I'll hop back on here. Okay.
Okay. Is
But
there a
if you can't make
password
it,
to it
what?
or
Nope, it's just in our Zoom